Hello, everyone, and welcome to this audio podcast. As part of the Medulla Dossier series, and this audio podcast as part of a Labostix Vortex. This audio podcast as part of a bulletin, Brick and Brack, and this audio podcast as part of a Storm Labostix production. In this audio podcast, a little bit around the intro to this, into some peer-reviewed works from 2014, around 2014. So, chronic kidney disease (CKD) is a life-threatening, enduring condition that requires lifelong treatment, such as renal replacement therapy. Um, the prevalence of CKD appears to be increasing globally, or has been increasing globally, and is likely to increase further as a consequence of increased prevalences around primary conditions. Approximately um, approximately approximately around 6 to around 7% of the adult population in the United Kingdom have stages CKD between CKD stages 3 to 5. There is a correlation. There's a correlation between coping with the stresses of living with a chronic illness, a long-standing illness or long-term condition, and health related quality of life, or HRQL. There is a consistent association between a decline in HRQL and increases in morbidity, hospitalization, and adherence with treatments or treatment modalities. This peer review works. The peer review publication describes one initiative where patients and carers have developed an online support group for those living with CKD. It is also an example of user and care involvement in clinical practice and research. One example of user involvement initiative has also been the Kidney Research and Education Initiative, KREI, a group sort of retrospectively in City, based at an academic institution in London in the United Kingdom, with the focus to promote excellence in around education and renal research or kidney research in collaboration with all stakeholders, including service user, carers, and clinicians. Patient and carer members in around the KREI, the Kidney Research Education Initiative, retrospectively, have been influential in prompting education and research proposals, enabling the views of those accessing services to have direct involvement in aspects around the design around services. The KREI initiative provides an example of a greater of greater of the greater involvement of service users in sharing lived experiences or life experiences, which in turn impacts on clinical practices or medical practices. That draws this audio podcast to a close. This audio podcast is part of the Medulla Dossier series. This audio podcast is part of the Labostix Vortex. This audio podcast as part of the bulletin Brick and Brack. This audio podcast as part of a Storm Labostix production.